Where's my screen? Share. Can you see my PowerPoint?
Yes po.
Yes, Doc.
Okay. So this subject is called feline medicine. So we're going to focus on cats. Have you guys done small animal medicine? Or this is your first? Have you done small animal medicine before?
No, Doc.
No. So what medicines have you done?
Sabay-sabay medicine subjects.
Have you done cattle medicine?
No, not yet, Doc. Sabay-sabay po sila ngayon.
Ah, okay. All right. So okay. So the important thing about medicine is okay. There's just someone coming in. Okay. So the most important thing that you need to learn when you're doing medicine is how do you approach a case. Okay. So there are a few things you need to understand when you have a case, and there's a few rules that you need to remember. Sorry, I'm just admitting some of your classmates just coming in. So the first rule that I use is have no preconceived ideas, preconceived diagnosis, meaning if you have a cat, okay, that's presented to you, you need to have a blank mind. You shouldn't be thinking about anything, no diagnosis yet, because if you start thinking of a diagnosis, then you might, sorry, I'm just admitting some of you guys. Okay, so if you start thinking of a diagnosis, then you might make a mistake in diagnosing your patient. Okay, so that's number one. Number two, you need to watch the patient from a distance. Okay, and while watching the patient from a distance, you need to be taking very thorough history. So a thorough history is what's the complaint, what's the complaint of the owner, um, uh, if there's vomiting, how many times a day, what's the color of the vomiting, does the vomiting happen after a meal, or it just happens even before feeding? So those are the history that you need to ask the owner. The third part is do a comprehensive examination. So a comprehensive examination um, must happen after your history taking. So what when we say a comprehensive examination, what is included in a comprehensive examination? Could you give me an example of the information that you need to get for a comprehensive examination? Just
Palpation, Doc.
all right, palpation. What part?
Um, where the lymph nodes are, ano, Doc,
Okay,
kung saan ko
lymph
nakikita
nodes.
yung lymph node.
Lymph nodes or palpation of the abdomen. Okay. But I would start with the vitals of the patient. I would start with weight, okay, with temperature, heart rate, respiration, and if you're going to listen to the chest, you need to check if there's a heart murmur. You need to listen to the lungs. You need to palpate the abdomen to check if there's any lumps inside the abdomen. Okay. You need to check. So basically, your examination needs to be very comprehensive. So, meaning, if you start from the tip of the nose to the end of the tail, you need to do that in every patient you see. You shouldn't change it all the time. Some vets start from the tail to the tip of the nose. So it's up to you, as long as you have a system to perform a comprehensive examination. Okay. So after getting the history and doing the examination, then you can ask yourself, can you formulate a list of differentials? It means with the history and the examination, do you have an idea what's wrong with the patient? Okay. If you don't have any idea, the next question is, do you need to do bloods? Okay. Do you need to do imaging? Or if you have no idea, the last part is, do you need to refer to a more experienced vet? Okay. So have you guys been to Facebook lately? So you use Facebook regularly, right?
Opo, Doc.
No, no. Have you seen that case about the husky that died? The husky with jaundice? Did you see that?
Opo, Doc.
Yeah. That's a case of maybe the vet has should have referred that to another vet. Okay. Okay. So this is just a general rules on how you approach your case. Okay. Let's go to the next one. So next slide. Okay. So history. Okay. So when I do, this is what I do. Okay. This is not in the book. This is what I do daily when I see a patient. So the first thing that I ask the owner is, what are you worried about? Okay. So because owners bring their dogs or cats to you because they're worried about something, right? So either they're worried about the cat not eating, or the cat is eating too much, or the cat is not drinking or drinking too much, or not pooping, not defecating, or maybe the cat has diarrhea. Sometimes their concern is the cat is coughing, the cat's vomiting. So there's the vomiting and regurgitation. These are two different things. Okay, two different things. This is not the same. Okay, we're going to talk about that in our next in our next lectures. And also there's also seizure, weakness, and lameness. And sometimes the owner is concerned that the cat cannot see or cannot hear. Okay, so these are just examples of the history that the owner will provide you when you're in the consult room. Okay, so examination. So we said weight, heart rate, respiratory rate, cardio. When I say cardio, it means you need to listen to the heart if there's a heart murmur. Okay, everyone understand what a heart murmur is? Do you understand what a heart murmur is?
Yes, Doc.
Okay, so a heart
Yes, yes
murmur.
po, Doc.
So what is a heart murmur? Tell me, what's a heart murmur?
An abnormal sounds of the beating sa auscultate po ng heartbeat.
Okay, so it's an abnormal sound. Why? What's causing the abnormal sound?
Sa ano, Doc, there are lot of factors, different heart sounds. Sometimes, Doc, if the flaps or the lips are damaged.
Okay, so if the flaps of the valves, is that right?
Yes po, Doc.
Okay, so when the flap is damaged, what happens? What happens with the blood?
When the flaps are damaged, it alters the normal blood flow of the systemic circulation, and it creates a sounds that we hear in auscultation.
Okay, so what's happening if the valves is damaged? What's happening with the heart? So what is the purpose of the valve? Bakit ba may valve? What's the purpose?
To avoid backflow, Doc.
All right, to avoid backflow. Very good. So if the valves are damaged, what happens with the flow?
There will be mixing of
So what do you call
blood.
that? There's a what's the word?
Shunt po, Doc.
There's a
Shunt.
no, that's different. That's not a shunt. No, there's a leak. Oh, may leak. Okay, there's a leak in the heart. So when the valves are not damaged, it stops the blood from flowing backwards. If the heart, if the valves are not closing properly, what happens is every time the heart pumps, there's a leak. The heart backflows. Okay, and that leak is what you hear as a that's the murmur. Okay, so a murmur is is a valve that's leaking. Okay, that's a leaking valve. Okay, that's the murmur. Quality of respiration. Okay, quality of respiration. Um, you need to check the quality of respiration. Is the animal having difficulty breathing? Okay, is the breathing normal? Okay. Is there abdominal breathing? Meaning, if there's abdominal breathing, the abdomen is getting sucked in every time the dog inhales. So that's not normal. Okay. Abdominal palpation. What do you need to check for abdominal palpation? You need to check for pain. Okay. And you also need to check for possible lumps, tumors inside the abdomen. If there is a tumor in the spleen, you can actually feel the tumor, okay, when you're doing abdominal palpation. Neurologic exam, you need to check if there's any neurological signs, if the cranial nerves are all working properly. Is there lameness? Okay. Is there lameness or is there ataxia? Is the dog walking properly? Okay, these are the things that you need to do in your examination. Okay, next. Differential diagnosis. So once you've done your history and you've done your examination, then you need to form a differential diagnosis. Remember, there's a lot of for example for diarrhea, there's a lot of cause of diarrhea. So to guide us on thinking about differential diagnosis, so this is actually degenerative. Okay, that's just the wrong spelling. Okay, so that's degenerative. Okay, so that's degenerative. So the mnemonics, okay, that you need to remember is dam it v, which is degenerative, anomalous, metabolic, neoplastic, nutritional, inflammatory, idiopathic, traumatic, vascular. Okay, so you need in every time you see a patient, you need to start thinking about this. So there's 1, 2, 3, 4, 5, 6, 7, 8, 9. Okay, there's actually 9 possible differential diagnoses you can think of. Okay. Okay, let's try an exercise. Okay, so if you have, okay, let's see. So if you have a 10-year-old female domestic short hair cat, okay? Not D6. The cat is still eating, kumakain pa, but did not eat this morning. Hindi na siya kumain this morning. Okay? Um, yung pusa is drinking a lot of water. It's drinking a lot of water. And also the cat had a cycle 4 to 6 weeks ago. Do you understand what a cycle means?
Kakahit lang po, Doc.
Okay, so heat. So what's next? What's next? What do we need to do next? Tell me. So this is your history. What do we need to do next? Okay, so 10-year-old cat, hindi siya D6. The cat was still eating, but this morning the cat stopped eating. Okay. The cat is drinking a lot of water. Okay. And also it had the cycle 4 to 6 weeks ago. Nagkaroon siya ng heat 4 to 6 weeks ago. What's next? Okay. So you are the vet. You are in the consult room. What is the next thing you need to do? There's no wrong answers. What's yes.
Ano doc, run some blood works.
Do you want to examine the cat first?
Physical exam, Doc.
Physical exam. Okay. Okay. Physical exam. Okay. Let's physical exam. Okay. So you need to approach this with this. Okay. Degenerative, anomalous, metabolic, neoplastic, nutritional, inflammatory, idiopathic, traumatic, vascular. Okay. Can what kind? Okay. Let's go to your examination first. Okay. So you examine the cat. It's the weight is 5 kilos, temperature is 40, heart rate is 180, respiratory rate is 50. The abdomen is slightly distended. There's no heart murmur. Okay. Can you think of a differential? Let's go back to our differentials. Okay. Uh, can you think of a degenerative problem that this cat might have? Any degenerative problem? Because it's an old cat, right? It's an old cat. Okay. So degenerative problems, usually you see that in old cats. Okay. What do you think? Meron kaya siyang dementia? Nagde-dementia kaya yung pusa? How about anomalous? Is there any problem that can cause increased water, what they call this, increased water intake? There's a fever. Um, what else? The cat's not eating. Okay. Remember, the cat just had a cycle. Okay. How about metabolic? Can you think about a metabolic problem that can cause increased water intake? What's a metabolic problem? Metabolic means, when we say metabolic, it means it has something to do with hormones. It has something to do with with glucose, with electrolytes. That's metabolic. Can you think about anything that can cause increased water intake, metabolic causes?
Diabetes po.
Sorry,
Diabetes po, Dok.
diabetes. Okay, that's one. Okay, how about a hormonal problem that causes increased water intake? That's common in cats.
Hyperthyroidism, Doc.
Hyperthyroidism, yes. Yeah, that can be. That can be. Neoplastic. What's a neoplastic? That's common in cats. There's a lot. Well, there's a lot of cancer that can affect cats. Okay. Nutritional. What can cause? What's a nutritional? What's in the food that can cause the cat to drink a lot of water?
If there is a doc, high sodium intake.
High sodium. Okay, that's good. Okay, that's good. How about inflammatory? What is there anything that is there a do you think there's an inflammatory component in this problem? So the cat is drinking a lot of water, has fever, not eating. Do you think there's an inflammatory problem in this cat? Inflammatory means infection. Okay, do you think there's an infection? So if the temperature is elevated, do you think there's an infection?
Yes, Doc.
Yes, yes, there's an infection. Most likely there's an infection somewhere. Okay, because there's fever. Idiopathic means there's an unknown cause. The cause of the problem may be unknown. Traumatic is there any history that the cat is injured? Nabangga ba siya ng sasakyan or nahulog ba siya sa puno or what? Is there any history? Is there anything in the history that suggests um, that the cat is there's a traumatic cause? What do you think? Go back to your history. Was there any mention that the cat's injured?
No, none, Doc.
No, there's no. So most likely there's no traumatic cause. Vascular meaning in cats, when you talk about vascular injury, this is usually because of embolism. Okay. Okay. There's an emboli, there's a blood clot that has traveled into the body and has caused blockage in blood supply. So in cats, the most common cause of vascular injury is embolism that gets lodged into the caudal arteries and causes paralysis. So is there a mention that this cat has hind limb paralysis? Is there any mention in the history that the cat's paralyzed on the back legs? Go back to the history. All right, let's go back to the history. Okay, is there anything in the history? Oh, sorry. That's not the history. Okay, sorry. Okay. Is there anything in that history that suggests that the cat has any vascular injury? Nothing, right?
Yes, Doc.
There's
Yes
nothing.
po.
Okay. So let's do bloods. Okay, so we did bloods. Everything is normal. Everything is normal except for the white blood cell is 50,000. What's the normal red? The normal white blood cell is up to 17,000. So the white blood cell is 3 times the value. That's abnormal. Okay. And also the lactate is elevated. So if lactate is elevated, it suggests two things. It can be the cat is hypoxic or the cat is septic. Okay, there's an infection. Okay. So if we go back, so what do you think? So there might be an infection because there's an elevated white blood cells. Okay. So you did an ultrasound. So you found this. So you found a dilated uterus. Okay. You found a dilated uterus. So what you did is you gathered everything together. So you got um um you have a 10-year-old cat drinking a lot of water, just had a cycle 4 to 6 weeks ago. It's not eating, it's got a dilated uterus, and its white blood cells elevated. What do you think is the problem? Any guess? So if you see this combination, usually there's only one problem. What do you think? Especially if the cat has had a cycle 4 to 6 weeks ago and there's a dilated uterus. Anything that comes in mind?
Is it
Suspect for
pyometra, Doc?
pyometra.
All right, pyometra. Okay, that's right. So this presentation. Okay, this presentation is classic pyometra. This is classic pyometra in cats. This is classic pyometra in dogs. Okay, so usually pyometra happens in older animals, older dogs and older cats. Of course, the patient is not D-sex. If the patient is D-sex, then it's not pyometra. Wala nang uterus, di ba? And also, pyometra, uh, before the cat gets really sick, a cat with pyometra drinks a lot of water. Why do you think that the cat drinks a lot of water? Why? Anong palagay niyo? What do you think? Why is the cat drinking a lot of water when there's pyometra? What's the pathophysiology? So this is now physiology and pathology. This is pathophysiology. What causes the cat to drink a lot of water when there is pyometra? Because when you understand this, then you understand why the cat's drinking a lot of water. Okay, so what happens is because the uterus is full of pus, okay? So the pus releases toxin, and the toxin gets carried into the blood, and the toxin gets carried into the kidneys, and the toxin actually damages the kidneys. So when the kidneys gets damaged, what happens? The kidneys cannot filter the water. So the cat creates a lot of urine. So when the cat urinates a lot, what happens to a cat when it urinates a lot? What will happen?
Dehydration.
Okay, so the cat gets dehydrated. So pag dehydrated ka, ano nararamdaman mo? If you're dehydrated, what do you feel? What do you want to do pag dehydrated ka?
Thirsty, Doc.
Thirsty, di ba? That's simple, di ba? So because you're so in a cat with pyometra, because the kidney is damaged, it's not absorbing the water because the tubules are damaged. So it's the cat is losing a lot of water from the urine, and because of that, the cat gets dehydrated, and then the cat gets thirsty, so the cat drinks a lot of water. Okay, so that's what's happening. How about the cycle? So when the cat goes on heat, why is um, why is uh, cycle and pyometra related? Why? What do you think? Can pyometra happen without a cycle? Pwede bang mangyari ang pyometra na hindi naglalandi ang pusa? What do you think? You know, you will see a lot of this pag mga vets na kayo. You will see a lot of pyometra. So that's why you need to understand the importance of asking the question, did the cat had the cycle? Naglandi ba yung pusa nyo? So what's the relationship of cycle and pyometra? What do you think? Any any guess? Oh, there's a chat. Maybe the chat has an answer. Wala. You can answer through the chat if you don't want to speak. Okay, let's talk about the cycle. So what happens is when when a dog or a cat goes on heat, the uterus becomes the walls of the uterus develops. Okay, and in that development it becomes very nutritious. So if there is any contaminant coming from the blood or coming from outside, it's very easy. It's very easy for the uterus to get an infection. Now, why the animals all? It's because when pyometra happens in young cats or young dogs, very seldom. It doesn't really happen a lot. That's why usually, in my experience, pyometra happens probably about 6 years old up. Okay, so our recommendation to the client is, if you're not planning to breed the cat, make sure you desex the cat so that the cat will not develop pyometra anymore. Okay. Okay. So can you guys see the process? Okay, the process that this is the process that I use when I check patients. Okay. It's very important that you have a process. Because, for example, let's go back. Let's go back. Okay, let's go back. Okay, let's go back to this case. Okay, so uh, what's the history? What's the history? Hang on, let's go back. Okay, so let's go back there, not D6, still eating but not eating, drinking excessively, drinking excessive amount of water, just had a cycle 4 to 6 weeks ago. If you start thinking what other things can cause increased water intake, what other things can cause increased water intake, what do you think? You've already said it. So someone said sorry.
Diabetes po, Doc.
Yeah, diabetes can increase. So if you see this cat in your consult and you start thinking, oh, this is diabetes, then you've already made the mistake diagnosing the cat, right? Okay, you've already made a mistake. That's why when you're getting the history, you should not be thinking of any diagnosis yet. Just focus on the history. What other things can cause increased water intake other from diabetes?
Ano po, Doc?
What's that?
Kidney disease.
Kidney disease. Yeah, kidney disease. So
Kidney
if you start thinking about kidney disease during getting the history, then you've already made the mistake. You've already made a mistake. So in short, pag masyadong maaga, if you're thinking about the diagnosis too early, or ibig sabihin you haven't really done an examination, gusto mo nang mag-bloods, di ba? Oh, dumating yung pusa, hindi kumakain, bloods na agad. You need to have a history and you need to have an examination first, because if the cat has pyometra, believe it or not, if the cat has pyometra, history pa lang and examination, alam ko na it's pyometra. I don't even need to do an ultrasound. But we still do an ultrasound. We still do an ultrasound to confirm, because you need to confirm it when you go to surgery. Okay? So do you have any questions? Do you have any questions about the case? Do you get what I'm trying to teach you?
Yes po, Doc.
Okay.
Yes,
So
Doc.
okay, so it's what I'm trying to teach you is, wag kayong magmadali. wag wag kayo agad nag-iisip ng kung ano-ano. Halimbawa, this is a classic example. May there's a dog having bloody diarrhea. Ano na iniisip niyo agad?
What?
Bloody diarrhea, tapos
Parvo, Doc.
3 months old, parvo agad, di ba? So mali yun. Because there's a lot of things that can cause bloody diarrhea. Maybe you're right because parvo is very common in the Philippines, but parvo can also be caused by hemorrhagic gastroenteritis caused by food, eating spoiled food. Parvo can be hemorrhagic diarrhea can also be caused by eating rat bait, yung lason sa daga, them to bleed. Bloody diarrhea can be caused by Addison's disease, which is a metabolic disease. Okay. Um, uh, Bloody diarrhea can be caused by constipation. Bloody diarrhea can be caused um, by intussusception. So there's a lot of causes of bloody diarrhea. That's why it's very it's going to cause a lot of problems for you if you think of a diagnosis when you're doing a history, because it's going to it's going to cause a bias in your diagnosis. Okay, so so this is pyometra. Okay, that's pyometra. Okay, that's normal. Can you see my pointer, guys? Can you see this?
Yes po, Doc.
Okay, so this is normal and this is the pio. Okay, and and next question. When you have a pyometra, you always go to emergency surgery. You don't wait till tomorrow morning. Why? Why do you think?
To avoid sepsis, Doc.
Why do you get sepsis? Bakit ba nagkaka-sepsis? Ano ba nangyayari? Pag punong-puno na ng nana yung uterus, what happens?
It may go into the blood, Doc.
No, no. The uterus will rupture. Puputok yung uterus, magra-rupture. Now, the problem is, pag yung pus goes to the intestines, pag pumunta sa abdominal cavity, it's very hard to save the dog. Okay? Napakahirap ng buhayin ng aso mo if the uterus has ruptured. That's why, if you have diagnosed pyometra, for example, dumating yung the cat came in 8 p.m. Tapos you've diagnosed pyometra at 10 p.m. You need to go to surgery that night. Okay? You need to go to surgery that night, because if you don't and the uterus ruptures, then what will happen is your cat will die. Most likely the cat will die. So a pyometra is an emergency surgery. Okay? Any questions about pyometra? Any questions? Keep going. Do you want to keep going? Okay. So so when you see a hindi ko na makita yung lecture ko. What's this? So when you see a patient, what do you see? When you see a patient in your consult rooms, what do you see? Do you see the virus? Do you see calicivirus? Do you see herpes virus? What do you see? Ibig sabihin, pag dumating ba yung cat sa consult room, um, is there any clinical sign that suggests that it's FIV or it's calicivirus? Is there what do you see? Why do they go to the vet clinic? So what they see problems. Okay, so as a vet, it's very important that you know how to analyze the problems that you see when you do a consult. Okay, this is very important. So what are the common problems that you see? Okay, so we'll discuss that. Okay, so the common presenting problems is So there's 1, 2, 3, 4, 5, 6, 7, 8. So actually there's 8 general problems that you see when you see patients. So one is diarrhea, next one is vomiting and regurgitation, next one is coughing, sneezing, dyspnea, and effusion. Fourth, weight loss, polyuria and polydipsia. Polyuria, drinking a lot of water, polyuria, urinating a lot, polydipsia, drinking a lot of water. So with polydipsia, what is too much water for a cat? So when do you say the cat is polydipsic? When do you say the cat is drinking too much water? How much water? How many ml per kilogram? Just make a wild guess. What do you think? 200 mil, 200 ml per kilogram ba ang too much water for a cat?
100 ml po, Doc.
200 ml? Okay. Actually, it's 50 ml. Alright? 50 ml. Ang pusa, mahina lang uminom. So if the cat drinks more than 50 ml per kilogram, that cat is drinking too much water. For example, if the cat is 5 kilos times 50, ilang ml yon? So 5 times 50 is 250, right? So if the cat is drinking 250 ml above, that 5 kilogram cat is drinking too much water. Okay, so that's the definition of polydipsia in a cat. Okay. Seizures and syncope. Seizure is, alam niyo naman na yung seizure, yung nanginginig, seizure, seizuring. Okay? Syncope means hinihimatay. Okay? Hinihimatay yung cat. So with syncope, when do you usually see syncope? Kailan niyo ba nakikitang hinihimatay ang pusa? And also this is true in dogs too. Kailan ba sila nagfe-faint? Ano bang sakit 'yon? Why do cats, so the most common reason why cats faint, hinihimatay, is because they lose blood supply to the brain. So what causes a loss of blood supply to the brain? Ano ba ang nagpa-pump ng blood?
Kaya pa yan.
Sorry? So what
Heart
pumps
po, Doc.
sa heart? Okay. So usually cats with heart disease, yung very advanced heart disease, nagsisyncope sila because the heart doesn't pump enough blood anymore. It doesn't pump enough blood anymore to the brain. That's why when the brain loses blood supply, nagba-black out yung pusa, hinihimatay. Okay? So usually, cats that has fainting spells, yung hinihimatay, usually may heart problems siya. And the heart problem of those cats are very advanced, no? Very advanced. Jaundice, alam niyo na yung jaundice, di ba? Yung nagyayellow yung skin, yung gums. Jaundice is usually because of liver disease, but jaundice is not always because of liver disease. Jaundice can also be because of hemolytic anemia. Okay? Okay, so remember that. Jaundice is not always liver. Jaundice can also be caused by hemolytic anemia. Epistaxis. What's epistaxis? What do you think is epistaxis?
Nose bleeding, Doc.
Nose bleeding. Okay. Melena is, what's melena?
Blood in ano
Blood,
uh,
blood,
blood.
bloody diarrhea.
Oh,
Okay, bloody diarrhea is melena. Hematuria is blood in the urine. Okay. So if you look at these problems, when you learn how to analyze these problems, then siguro 90% 90% of the diseases that you will encounter when you practice, magagamot nyo. 90%, baka more pa, maybe more than that. Because these are your presenting problems. So what I'm saying here is when you're diagnosing a patient, you focus on the problem. Okay? You focus on the problem that you see. Okay? Kailangan yung problemang nakikita mo. Huwag kang mag-iimbento ng problem. Huwag mong sasabihin na nagsusuka. Don't say it's vomiting kung ang problema pala ng pusa is regurgitation. Magkaiba 'yon. It's two different things. Okay? So you need to be very precise when you describe the problem. Because vomiting, okay, actually regurgitation is it's a more serious problem than vomiting. Mas gusto ko na yung vomiting kaysa regurgitation. Okay? Coughing, for example, coughing can be caused by the lungs. Coughing can be caused by the heart. Okay. Okay. So in our next lecture, what we're going to do is we're going to discuss each one of this in detail. Para when you see diarrhea, then you can work up what's the possible cause and also how do you treat a patient with diarrhea. Okay? Because the treatment for diarrhea, a patient with diarrhea, usually pare-pareho lang naman ang treatment siya. The treatment with vomiting, regardless of cause, is almost the same. Okay? Okay. Do you have any questions? Do you have any questions? Guys, do you have any questions?
None po.
None, Doc.
None, Doc.
Okay, so what we're going to do next week, what we're going to do is we're going to discuss all those problems. So now we're going to start with diarrhea, then also we're going to start on vomiting and regurgitation. Hindi muna tayo magfo-focus sa specific diseases because the specific diseases, pag pinag-aralan niyo yung specific diseases, pero hindi niyo napag-aralan yung problem-based diagnosis, then hindi niyo ma-diagnose yun. You cannot diagnose that by studying the diseases. You really need to do a problem-based approach. Okay? So problem-based meaning you focus on the problem. Diarrhea, vomiting, regurgitation, weight loss. Those are the presenting problems. And then for our next meeting, I'm going to present to you cases, okay? Cases that will show the benefit of focusing on the problem instead of the disease of the cat. Okay. If you have no problems, I'll see you again next week on a Monday. But if you have questions, please ask. You got any questions?
Wala na po, Doc.
Wala na? Okay. So what I'll do is I'm going to stop the recording and then I'm going to send the recording to you guys. Okay? Okay. So if there's no more question, I'll see you next week on next week again, Monday.
Yes,
Thank you,
Doc.
Doc.
Thank
Thank you,
you.
Doc.
Thank you.
Recording stopped.
Thank you po, Doc.